Does the Texas Hospital Association support your bill?
Yeah, I haven't talked to them, but they have not told me that they don't support it.
In fact,
and I think they would probably call and tell me if they did not support it.
Well, in fact,
because I have a good relationship with them.
They do not, in fact, actually.
They didn't call and tell me
that. Well, I'm sure we will hear from that. And so tell me, well, I'll skip that because I know we have some time considerations and people that have traveled far. Another question in your bill is that that these hospitals provide obstetrician and gynecological services. Can you define what that means? I mean, is that a designation that hospitals use? Because I did ask the Hospital Association, and they didn't know what I was talking about.
Now say that again.
You have a designation, obstetrician and gynecological services that the hospital provides.
Where are you looking on this?
I'd have to look at your substitute.
Okay.
But it is,
are you still under the section for the 30-mile rule? Is that the section you're talking about?
Yes. Okay. Hospital visitation privileges. You're requiring that. And I'm sorry, I can't look this up right.
No, that's okay. I'm gonna find it in the bill. So I just wanted to make sure we're still in the same section.
What you would know about that? I mean, it's pretty clear.
The admitting privileges are medically. Yeah, I'm going to read you the exact word. It doesn't specify obstetrician, gynecological. It talks about...
Your original bill did, the one you filed...
We're talking about the substitute.
And during the session it did as well.
But I didn't file the 30-mile rule. I filed the 3-1
I will look at this, and in your closing, I'll come back to that.
Okay.
I think we're talking page 2. Are you? Did you find it already?
What page? Page 2 on the substitute?
Yeah. Page 23. Yeah.
Oh,
Line
active, you're right. Line, okay, on the substitute on page 2. Okay. Okay, that the hospital, the doctor should have active admitting privileges at a hospital that provides OB-GYN health care services. Well, that would make sense if you have a woman coming in.
Right,
that kind of falls into that category.
That? I mean, how is that designation?
I think it's a very broad term. I think it's, OB-GYN is pretty much dealing with women's health.
But how do you define that as a hospital does it? Because the Hospital Association didn't have that designation. That had no meaning to the way they do business.
Probably. Okay, you found it.
I'll ask them about that again, and
sure.
I think that's an important point. Are medical abortions included in your bill? And would a doctor need to have active hospital admitting privileges to administer a pill?
Okay. Any abortion doctor providing an abortion, medical or otherwise, would need to have privileges with the hospital, yes.
All right.
Because even with the RU-486, especially I would think with the RU-486, especially since you have a higher number of women that do abortions with that, there can be a lot more complications going on.
What kind of complications?
Excessive bleeding, partially, the abortion takes place and perhaps not all the baby has been injected. Just anything can go wrong.
That's interesting. All right, let's go on to ambulatory surgical centers. Can you explain how the current regulations governing abortion facilities work?
Okay, say that again.
Ambulatory surgical centers. Can you explain how what the current regulatory environment is for abortion facilities?
Hold on. I will. Just hold on. Do you mind if I look through my notes?
Absolutely not.
I apologize. I don't have everything off the top of my head. Okay, you want to know the differences between abortion facilities and the...
No, the regulations. If you can explain the
Okay, the
current
regulations,
for
okay.
abortion facilities, the current regulations.
The regulations for abortion facilities or the ambulatory?
Abortion
Okay,
facilities.
abortions. They're licensed to perform abortion procedures only. And when a patient is in the recovery room, let's see, the patient is typically discharged after a few hours. There is a $5,000 renewal licensing fee. The state does an inspection annually. There are no life safety code requirements.
And those annual inspections, are they announced or unannounced?
Hopefully unannounced, but that can be kind of, I'm dealing with some things like that now, and some folks don't always get ahead of the announcement or they get behind the announcement.
Well, indeed, they are unannounced.
They're supposed to be.
Can you announce? I mean, can you explain the difference between the current regulations of abortion facilities and the ambulatory surgical centers? I'm sorry, not the regulations, just the difference between the two, because you're elevating to the ASC.
Right.
And so, what's the difference between the two, and why are you?
Well, on the ASC, one of the differences is that a qualified medical personnel person must be available for emergency treatment whenever there is a patient in the ASC that has received services. That is one difference. Another difference are the facilities which are required to meet certain physical life safety code requirements, and this would include pre-op rooms, an emergency generator, air filtration for cleanliness, electrical, spatial requirements. Those are some of them.
And what's the need for those?
Cleanliness. A pre-op room is you're going through a procedure, so it's always better to have a higher standard to make sure that the woman is taken care of in the best way possible. Emergency generator. What if you have a storm? Lights go out.
What if one is, well, we'll get to that point. So do abortion facilities today report complications? Are they required to report complications?
I don't know.
You don't know?
I don't remember. I don't know.
I think you should know that if you're elevating this to such a high level.
Well, if a person has a complication, many times they go into a hospital. That is not always reported as an abortion complication tied to the abortion center.
Well, actually, since you don't know, I will tell you.
Well, I'm saying I don't know that it's always reported in the way that it is pointed out that the complication occurred at the abortion center.
Well, in fact, you should know this because they are indeed tracked. They're tracked internally, and they're reported to DISHs. And
they're supposed to be.
There are severe consequences if they're not.
If they find out. And there are cases where the records are very difficult to obtain, unfortunately.
What evidence do you have that? I mean, saying something is one thing, but providing evidence of that is another thing.
I have met with some folks and had that discussion.
Was there a
Yes.
report on this? What, okay. Sorry. So back to abortion facilities. Do you know that they are whether or not they are required to have a quality assurance program?
The abortion facility?
Mm-hmm.
A quality assurance program, yes.
Okay. Do you know if they are required to have a program for infection control?
As part of their regulation standards?
Mm-hmm.
They should.
They do. Or do you know if they are required to have emergency drills and protocols for emergencies?
They should.
And they do.
Okay.
Do you know what the rate of complications for abortions are in the United States?
Do you know? I do not have that statistic in front of me.
Okay, I think you should know it, and I think you'll find it interesting that fewer than 0.3% of abortion patients experience a complication that requires a hospitalization. And given that these abortion facilities are already required to meet all these standards, can you explain specifically, because I'm trying to get my head around this, why we should require abortion facilities to meet ambulatory surgical center standards?
Again, to improve the health standards for a woman going through this procedure. Right now, abortions that are 16 weeks and older are required to be done in an ambulatory surgical center. And what this does is it brings all the rest of them up to that same standard.
Are you not concerned, though, that in doing so, you would put the access, you would take it outside of a woman's reach?
No.
Because what I'm saying is if you have such a low rate of complication, it's so highly regulated already, the facilities under 16 weeks, and then you take the cost and the ability to get to a facility, it's estimated that there will only be 5 ambulatory surgical centers or place that a woman could go to after this. And this is for the medical one as well. This is for all abortions. There'd be 5 in the state.
Do you have proof of that? Because, Jessica, you can make that statement, but it will not shut the abortion clinics down. It will raise their standard of care for a woman going through this procedure.
I think that's a false statement, though. I'm saying that your lieutenant governor said that. He tweeted it personally. But the point was to make sure that abortion didn't stay safe and legal, to take it out of the access of women. And my concern is that when that happens, desperate people do desperate things in desperate times. And I go back to the generation before me, and there are lots of stories to tell, and there have been recent stories as well. What happens when you don't have access? And so in trying to say that you are increasing the standard of care to such a level, you can increase it to the point where it's inaccessible. And so I take issue with the thought that we're needlessly over-regulating in order to shut facilities down and to shut this access down. Anyway, let's see. Maybe move on. You are aware of the Lieutenant Governor's tweet, aren't you?
I'm sorry, what?
You are aware of the Lieutenant Governor's tweet, aren't you?
No, I don't tweet.
You know?
Sorry. I barely do Facebook.
Well, it's interesting. There was something put out that said keep abortion safe and legal, and I'll give it to you right here. He says, David Dewhurst posts, we fought to pass SB 5 through the Senate last night, and this is why.
I'm not sure what this line of questioning has to do with the bill author. If we want to talk about the Lieutenant Governor, this is probably not the place.
It goes to the motive.
Well,
it goes to the motive of why we were.
I can tell you my motive. My motive is to
never
raise.
have been a part of legislation. I mean, we don't question people's motives. Instead, they bring a bill before us. We consider it. It's not about why they did it. They have their very personal reasons. They have very public reasons for their district.
Right, but we're saying
why are we talking about
because the authors of the bill are saying, and the proponents of the bill are saying it's about one thing, when the Lieutenant Governor says it's about something else.
Well, ultimately, it's about saving lives and saving the unborn and protecting them from being killed. So that's what this is all about, and that's what we want to talk about.
And I respect your position on that. I do. But
I just don't think what the governor, lieutenant governor, or anyone else tweets has anything to do with what Representative Laubenberg is doing in her bill. She can't be responsible for what someone else tweets, and it doesn't do anything about the credibility or the legislation of this author.
It goes to the effect of what
I think you
what
need to
the
have
bill
that
does.
conversation with the lieutenant governor then.
Representative Farrar, my motive is to provide the highest quality standards for a woman going through any kind of procedure, and in particular an abortion.
And my point is that we're over-regulating to a point where, and there's an intent to over-regulate to a point where there is no more access or severely restricted access. And that's some folks' idea of how you reduce the abortion rate. And that's an honest opinion. I mean, some people might feel that way, and I respect that position. I disagree with it. I think there are more effective ways to do it, but I won't go there. All right, I just have a few more questions. In the last section, abortion-inducing drugs, you have changed some of that. Did you adopt the
dual
language?
amendment? Yes.
Okay. So you're not going to go with the FDA protocol?
The dual amendment allows the abortion doctor to go by the recommendations of the OB-GYN college, which allows them to do a lower dose, which, as I understand it, would have fewer side effects, less severe complications.
Okay, because my understanding, and as I was listening, was, and I listened to Senator Vanderpute's questions because she is a pharmacist, and correct me if I'm wrong, but that the FDA protocols were moved slower than then if we adopt that, that's going to move slower than what the medical community uses. Correct?
You can make the statement. I don't know.
Do you know? Okay. Do you know that in other bills, because we're adopting whatever it is, whatever standard it is, we're adopting medication protocols. Are you aware that does the legislature in statute do that for other medications?
I can get back with you on that. Jessica, I don't have that information with me.
I think it's important to know because I think doctors should do medicine and
I agree.
We're not trying to do that. And
let me say this: we're also dealing with a situation where we are looking at terminating a life in the womb, and so to me that's a lot different than getting your tonsils taken out and prescribing some antibiotics.
I understand. I mean, this is a very complex issue. I mean, there are two lives involved. There's
yes.
a lot of other things. There's a lot of stuff going on, and that's why I want to make sure that we don't do something that's overly simplistic about this.
Absolutely.
For every woman that faces this decision, it's a story. It's a unique story. There are a lot of similarities, but I think it's important that this legislature recognize this and not legislate politically, but allow the medical professionals to do their jobs and we not hamstring them. Mr. Chairman, those are all my questions at this point.